Maggie Graham, and I'm the president of the board of for Twin County Recovery Services. So thank you all very much for having us here today. Special thank you to Chairman Muriel and then also Dan, for inviting us. We met with them a couple of weeks ago and they had asked if we come to tonight's meeting. So we're very happy to be here. And I think we wanted to really give an update, on what's going on currently, between Twin County Recovery Services and also the Addictions Care Centre of Albany. And also like our future plan, and what we're looking to do going forward. For close to 2 years now, we actually have had a contract with ACCA to provide management services at Twin County Recovery Services. And that came about as a result of some significant changes, within TCRS as far as the leadership there. And then there was a new ED that came, and unfortunately it just didn't work out in the way that the board had hoped. And there was a lot of instability, just lots going on there. And it was actually quite chaotic, I think, and very stressful, I think, for staff overall, and probably the clients that were also being served by TCRS. So we actually, Claire Pardee, who was the vice president of the board, and I have reached out to Keith and his agency to see if they could actually provide us with some service, the leadership piece, and administrative coverage, at TCRS. That resulted, in some, in us being able to enter into a contract, with Keith and his team, which actually has proved to be very, very successful, in stabilizing what's going on in TCRS. And then also, I think all across the board, the programs have stabilized, the staff have stabilized, the agency itself has stabilized. So we as a board, we've been very happy with the service that provided. During this time frame, the TCRS board, we've also done a lot of thinking about the future plan, for leadership at TCRS. What should that permanent leadership look like? Should it be another executive director? Should it be something that's more permanent with ACCA? And should we be looking to another, another provider, that we could actually have this relationship with? Well, I think that we've had, as I say, a significant period of time to really get to know ACCA. Our board decided that really the way to go was to really enter into a merger, with ACCA, a full asset merger. We thought about some other arrangements, affiliation type arrangements in the beginning, but definitely, we're looking towards a merger. I think that being said, ACCA they also have had time to really get to know us, the board of directors, the agency, the staff, and there's been some very positive comments and feedback, from ACCA about TCRS and the staff group that are there, and that they have a level of sophistication that they bring to the table, that we're also very interested in looking at having something more permanent with us. So at this point in time, that is where we're at. We've engaged the council for both agencies, in evaluating what needs to be done next. And of course, there's a very labor intensive and involved due diligence process. So we're kind of into that at this point in time. We also have involved, of course, the legal counsel, for both agencies who are working very closely with us. We have certainly involved the directors of community service and the county government in each county, to apprise them of what our plan was. We've also met with the directors at TCRS, and we've had a meeting with them. Following that, we had a letter that went out to staff, and then had a follow-up meeting. The letter went at 1 o'clock. We had a meeting with all staff at 3 o'clock. Everything I think so far has been accepted in a very positive light. We also know that we also feel that bringing these two agencies together, that certainly are well-known SUD providers, substance use disorder providers. TCRS, of course, for this area, for Greene and Columbia County. ACCA are up in the Albany area, but they also provide service up in Warren, Washington, Albany County, and Rensselaer County. So they really have a strong foothold in several other counties. So they really come to the table with a lot of experience, okay? And I think that experience we're feeling, the board, okay, is really feeling that it will really help to enhance the services that are being provided at TCRS, especially when it comes to some of the residential services. And Keith probably can speak a little bit more to what ACCA have been able to do over the years, okay, when it comes to residential services for people with substance use disorder. So I think that we see it as something that could really be a wonderful benefit to all, especially the clients, okay, that need this kind of service. We know that there's a long ways to go, and I think the attorneys for both entities did a very nice job when we met probably about 4 or 5 weeks ago in really putting it out there that this is not something that happens just overnight. We are looking at something that probably will take at least 2 years, okay, to get to the point where you're working and going to the Attorney General's office, okay, and really getting the approval from them. It could be 3 years, but again, we want to make sure that we continue to move forward, okay, in this way. We also had the opportunity yesterday to have a Zoom call with the commissioners of DSS, okay, in both counties. And I think, you know, our plan was well received, and I think we were very happy to hear that. We know that TCRS is embedded in both these places, okay, at DSS, and we don't want, you know, we want that to remain, okay, and we don't want anything to be disrupted in any way when it comes to services that are currently in place. But our hope is that, especially, I think both boards, is that there might be an opportunity here for us to have more services or enhanced services. So I think overall, you know, it's been going well. Some of the things that we certainly have taken into consideration is that the TCRS name, Twin Counties Recovery Service, we know that that is a name that is very highly thought of in both Greene and Columbia County. It's where people go for their SUD services. So some of the things that we've discussed is that the continuation of that name is very important. And we also recognize that there needs to be representation on whatever that board will look like, okay, for Greene and Columbia County, because we need to have a presence at the board, okay, so that we can actually, you know, speak to, that there's a voice, okay, for these counties, and we can speak to the needs of our communities, whatever that might be. And, you know, things come up over time. You know, some of the things that we have, again, another thing that we felt very good about, okay, the TCRS board, is that since Keith came on board with us, we've been able to make a lot of progress, okay, in some capital projects that seem to be out there lingering, but Keith followed up, okay, and one of them is the Red Door, which is the men's residence, and really having a new location for that going forward. And it looks like that will certainly be underway come 2024. You know, we know that there's other programs that definitely will need attention, and one of them maybe being the women's residence in Catskill that certainly provides service for both counties. So I think we're at a good point, and we're feeling very good about that and positive about that. I'm going to let Keith say some things as well, because he may want to add. I'm sure you do, and I'll take a break.
Thank you, Ms. Grant. Mr. Stack.
Yes, I'm Keith Stack. I'm the CEO of the Addictions Care Center of Albany, Connecticut resident. So, you know, very familiar with Twin County Recovery Services, their history here in Columbia and Greene counties. Actually, I'm in recovery, and I went through the program years ago. Good program, very successful. So the management agreement really started out as a 3-month agreement. We signed the lawyers drafted up an exclusive management agreement. You know, we started, we extended it. Then we finally realized, we've been there for, a length of time. Why don't we take the next step and work towards a more permanent affiliation? Both boards, agreed to that. And I think it's because of the, frankly, the smooth and easy transition over the last 21 months at Twin Counties. We did meet with the staff 2 weeks ago. They're, I would say, satisfied and glad we're moving forward in this direction. Again, we've been there so long. We've been doing, hiring of new staff. We've been able to provide raises to people, promotions in some cases, have continued to seek out new funding streams for new services. I think what's made it easy is that both programs provide essentially the same type of services but in different areas. We expanded into Warren and Washington County in 2017. So very familiar with working with, multiple local government units. Warren and Washington County are not unlike Columbia and Greene counties in just the geography and the demographics, very rural communities. A lot of isolated parts of the counties that, that don't get services. So there's a lot of service gaps. Twin Counties has a very robust mobile program that, is filling some of those gaps. We've had a small program in Warren, Washington County. We can definitely, learn and take advantage of Twin County's Greener Pathway program. We're essentially a residential program. We have 13 different residential buildings, 3 levels of care, the most intensive down to the least intensive level of care when people are they're finishing up their treatment experience and they're relocating back into the community. So that's a strength of ours. Twin Counties has a very strong outpatient programs in both counties. We have, since we started focusing on residential services under a new regulatory model, we have a smaller outpatient clinic now because all of our clients are receiving their treatment within, the residential setting, more intensive residential setting. So, the benefit of having a robust outpatient clinic certainly, is of value to the Addictions Care Center of Albany. The staffs have been working together, for decades, quite honestly, on referrals. It's a pretty kind of small and tight-knit, universe, the substance use disorder field. Clients, that complete one program will be referred to another one for the next level of care, whether it's more intensive or not as intensive. We share orders. The staffs have worked on coalitions together, and operate with shared funding streams as well. So there's a real known commodity for each program. Maggie had referenced, I think, 3 areas that the Twin County Board of Directors feel is very important. Number one is the branding or the naming of the organization. Twin County Recovery Services does have actually both organizations were both started operations in 1967. So I say that because there's a long history for Twin County and Columbia and Greene, but similarly for the Addictions Care Center of Albany and the areas that we serve. We think that has real value and merit. And one of the ideas we've discussed is coming up with kind of an LLC, the Addictions Care Center affiliates. So we wouldn't have to change ACCA, but the affiliates would be Twin County Recovery Services, the Addictions Care Center of Albany, and the Addictions Care Foundation. ACCA is a foundation as well. So that would all remain the same. Because the funding flows through the county governments, it's important to have representation on, a board of directors from all of the communities served. When we started operating in Warren and Washington County and Rensselaer County, we added new board members specifically from those counties. Because we interact with, the departments of community services in each of those different counties. I meet with the legislative bodies about contracting. So just an important, principle to have local representation on the board of directors. So that's certainly going to be the case. And really the other issue was staff. The Twin County Recovery Services staff roughly 62 staff, ACCO 162. All of the staff will, remain. They'll keep their jobs. It's a human service, right? So we're not making things, and so one person can't make more of something, to cut back on, administrative costs. You need people to provide treatment service. It really is a, interaction, personal interaction. The Twain County Recovery Services staff is frankly as good as ACCA staff. We're not concerned about that, the staffing issue. But we've made a commitment to, keep all of the staff. We have been, we've identified, perhaps a few differences in like benefit packages, and things, that can be overcome. You just grandfather in those particular people with those benefits. And over time, it kind of just shakes itself out as people, retire and leave. Those are, really just, kind of financial issues you can address. But I think, the bigger issues, both boards are in agreement on. Philosophy, provision of care philosophy, prevention, treatment and recovery, the whole continuum of care. So from that perspective, it really makes sense. And I think the way the organizations have been working together, for nearly 2 years, it just seems like a logical step for both parties.
Terrific. Well, we truly appreciate you both coming out. I mean, and, there's probably an initial concern if, someone in-house partners with someone out of house, so we might end up losing our talent, but it looks like, you want to keep all that staff here.
I think what's been really good is having the management agreement, and these services being provided by ACCA for quite a period of time. We've really had the opportunity, to really get to know ACCA, and I think, that's been very good for the board, but also for the staff that are at TCRS. I think it was also communicated very clearly, to the staff, when we met with them, all of them, that there is no plan, to change any, to eliminate any positions, change anything. If anything, we want to enhance what's there so that there's more available to these communities. But we appreciate you inviting us, and
No, thank you very much. To alert the public to this merger, to ease any concerns there may be. Unfortunately, I have a meeting in a little while that I have to finish before, so I'd like to just, if our Director of Community Services or our Commissioner of DSS had anything to say about this, to our supervisors, that are present right now, I'd like to hear from Dan or Bob, but not to put you on the spot.
I have a feeling it's time. So if you don't mind, I'll go first. One thing I'd like to say is I am very appreciative to Maggie as the president of the board and Vice President Claire Pardee, who've been meeting with me regularly, as well as my counterpart Jason Fredenberg, to update me. So this didn't come as a total surprise. It was kind of the writing on the wall. In terms of my thoughts and feelings about it, I'm cautiously optimistic. Nobody has a crystal ball and can without a doubt say it's going to be an amazing merger without any wrinkles or hiccups, but I'm confident that there's a commitment and that any problems will be worked through. I know ACCA's involvement has in fact been productive, as both Maggie Graham and Keith Stack have alluded. I witnessed that firsthand and heard from the OASIS representatives that I talked to as part of my role as the Director of Community Services. They mentioned to me that there's been an increase in census as a result of some of the hiccups that occurred prior to ACCA coming on board to stabilize things. There was a management plan that was put in place. That management plan is on the verge of being lifted due to the productive efforts of ACCA and the staff and the collective efforts. So those are very optimistic indicators of how things will go as this merger moves along.
Thank you, Dan.
Just very briefly, I'm pleased. I'm very pleased actually with a couple of folks that are from Twain County, still embedded. That's been going quite well. We actually had a couple of hiccups prior to the ACCCA coming down, that were cleared up very quickly. It's been very professionally run. We're very pleased as an agency. I'm also not surprised, just given how things turned around so very quickly. And I support this. And lastly, you know, and I said this on the phone yesterday, for branding purposes, it's been Twin County Recovery Services for years. That's what people have come to know and really respect, as Keith said. And the fact that that's going to remain the branding, I think, very important for both counties and clients. So thank you.
Okay.
Thank you. Any questions from the committee?
Do we gain or lose any services because of the merger?
The expectation is there'll be more services. You know, simply by being a large organization, you attract more funding. And, you know, that's really what it's about is, you know, expanding contracts, being able to, you know, kind of get into different areas. You know, one of the ACCA has been doing a lot of work in, jail-based programs, but also, we have staff embedded in the Rensselaer County Drug Court, and then they're creating a new Rensselaer County Family Treatment Court. And Rensselaer County that funding is coming through the Unified Court System. Those programs have been successful. We've actually just gotten word that those programs are going to be expanding statewide, and the courts in Columbia and Greene County are reaching out to Twin Counties to provide services like that. So I think, you know, that's the way it'll happen. Yeah, there won't be a, you know, the service, the need, unfortunately, just continues to grow. It's our job to meet that need.
All right, thank you. Anything else from the committee? We're truly grateful, Ms. Graham.
Thanks for having us. Appreciate it.
Thank you very much.
Thank you. Thank you.
I will certainly be in contact with Dan as. And best of luck. Okay, thank you very much. We have one to do, if you're ready. Okay. Sounds like you've already rolled up your sleeves. I did a while ago. Don't get though.
All right, we are gonna skip Office of the Aging, I believe. Do you have anyone in here? Although I do want to recognize a thank you card from a resident who attended the Office of the Aging annual get together in Stuyvesant. Very grateful for the services provided. So
I did attend that event. It was a very lovely event.
I missed it. I went to one last year. All right, so thank you to all the Office of the Aging staff for pulling off that wonderful event. We're going to move right into the Health Department with Director McGann. Now, did I pronounce that Irish name correctly?
Well, I pronounce it like that, but if you go there, it's McGann, not just one city, so.
I thought March was the day of the Irish.
Yeah.
Every day.
Every day.
That's right.
I'm Irish too.
All right, hi, everybody. I've got one, resolution today, requesting authorization to contract with Linda and Colditz for LGBTQ+ staff development training.
Sounds wonderful.
Do I have a motion?
I'll move it.
Do I have a second? Further discussion? All in favor? Aye. Opposed? Carried.
Okay, moving right into our director's report. As you can see, communicable disease was busy, 340 total investigations. We have one probable mumps, and then several foodborne, illnesses unrelated. August COVID numbers were up. We had 95 cases the whole month. You know, that's a significant jump from July.
Yeah, indeed.
Just to note, we did have one death in August, unfortunately. We are waiting for that death certificate to see whether it was a person with COVID or a person who, you know, expired due to COVID. So we hope to have a little bit clearer of an answer there when that information comes in.
Do people still self-report COVID, or are you just getting numbered?
They can, but We were instructed by the state health department to not count those tests in our numbers, because they were, there's just human error in at-home tests and people can say whatever they'd like. So that always comes up, right?
Right.
Wastewater surveillance was up and that looks dramatic. Where there was one sample that was quantifiable, which means 50 cases per 100,000 people. Of course, this is just the city of Hudson, so that has about 10,000 people. So that's probably 5 cases that caused it to jump like that. And it has since actually come right back down. We've gotten more recent wastewater surveillance that was not included in the August report. So that, again, that looks dramatic, but we're not, it's a spike, and it's, 5 cases is,
Right.
could be one family. This is the genetic sequencing for what was collected in the wastewater samples. Nothing really out of the ordinary there, or not unexpected.
Will we send it to me?
I'm so, we can fix that.
More legible.
Yes, our TB, we received 9 positive quantiferin gold tests. That's settling. We have 2 LTBI receiving treatment that we're surveilling, 1 completed treatment. Arthropod tick-borne disease is about normal for this time of year. We're starting to receive less reports each day, but fall is still a big time for ticks, so, it's important that everyone still takes this.
So 621 Lyme cases is normal.
But for about this time of year, that's year to date.
Yeah, I saw that.
Yeah. Rabies, we had 9 total rabies submissions, all negative, 8 bats and 1 cat. We had 12 new post-exposure vaccines, totaling in 40 total rabies vaccines administered. And then we did our Ghent rabies clinics for dogs and cats. Environmental health, August is a very busy month. They're inspecting bathing beaches, campgrounds, mobile food, swimming pools, temporary food. The fair is a big one in August. So they're running, they were very busy in August, and things start to slow down into fall for them. So that's good. Immunization and migrant programs, 118 non-COVID vaccines administered. We're starting, we got some flu vaccine in. We're starting to do those clinics this month. We talk a lot about COVID, but this is for young children in particular. This is their first non-masked flu season. So, kids under 2 and under, what was it, 3? We've been at those 3 years. Yeah. So kids under 3, we would suggest that they highly suggest they get their flu vaccine this year.
Although we did discover during COVID, when you wore a mask and washed your hands, you got all the rest of the influenza out of the way pretty much.
That's right. Yeah. So if you can,
Lesson learned.
Yes, enact those precautions, then it should be good too. We did 2 migrant outreach clinics and administered several vaccines, did blood pressures, blood sugars, screened for tuberculosis, provide education to the migrant farm workers. Preschool and early interventions, we're seeing some of the same continuous issues, provider shortages. We're into transportation bids for the school year in August, and many of that has been settled at this point. We're about down to normal referral levels in those programs too, which is good. Public health emergency preparedness, we've updated and approved and submitted a lot of our plans. This year is a big one for our deliverables because the past few years have been so busy in emergency preparedness due to the pandemic. So we're doing a lot of catch-up work on our plans, pandemic and otherwise, our crew plans and all of that. And they've been satisfactory so far. So we're chipping away at those. And then we provided outreach in several locations. We continued our opioid overdose dashboards, Narcan trainings, and our Sharps collection program collected 135.4 pounds in August, 950 pounds year to date. Home generated Sharps. Our LIXA program, very low in referrals for newborns, still 2 cases in our handicapped children, physically handicapped children program. Lead, we had 1 new care coordination for discharges, and 3 car seats were installed in the month of August by our car seat technicians.
You had a couple things on your agenda to discuss.
I
there.
did. So the first item being the commercialization of the COVID vaccine. I'm sure we're
Did have
all
questions on that.
aware that there is a new formulation of the COVID vaccine that was approved by the FDA and the ACIP through the CDC. That was a lot of letters. Sorry, I throw those at you. So this time around, the vaccine will not be provided by the federal government. And we will be required to bill insurances for the cost of the vaccine and the administrative fee, which had not been the case ever before us in the COVID sphere. So that complicates things, as you can imagine. So there will be programs to cover the un- and underinsured, of course. But we will have to bill insurances, and unfortunately our department does not work with every insurance out there. There are certain ones that we're just not capable. We don't have the infrastructure to jump through the hoops that they require. Like some require us to have a doctor on site all the time, which we just can't do.
Is it gonna get to the doctors where we could do it to our normal doctor, like you would a flu shot and get it, or they're not allowed to do it yet?
All the storage and handling is still as challenging as it was in the very beginning. Pfizer is only good for 10 weeks out of ultra cold freeze.
Yeah.
And many vaccine providers, including us, we do not have ultra cold freeze on site. You know, we had partners in Capital Region who would hold our vaccine for us until we needed it. And we still have those relationships, but
It's okay
you know,
for a clinic, but it's not okay for
right.
ongoing.
And many, you know, pharmacies will do them. There was an article today in the Times Union that people started booking their appointments, and then all of a sudden they got calls like, oh, your insurance company denied it because they weren't set up for it for whatever reason. They did not anticipate this, or you know, whatever their reasoning is. So they were denying the claims that the pharmacies were putting in. So these people had to either cancel and reschedule their appointments, or they were expected to pay $200. So that's not gonna work. So the other issue that we're facing is the financial risk. You know, paying for this vaccine up front is going to be a financial risk. And it's $120 to $130 per dose. Pfizer and Moderna, we needed to set up accounts with them because we were getting it through the federal government. Up until now, we didn't have accounts with them, so we had to go through the hoops that they wanted us to set up our accounts so that we could order. And there are ordering minimums. I think Pfizer is requiring a minimum of 100 doses. And they will do buybacks for our first order, to reimburse us if we have anything to waste that will go to waste. But that's the only time they're promising to do that. So anything after that is, is financial risk.
So you're saying it's a risk because we don't know how many people are insured and
I don't know how
then
many people will take it, you know.
We don't know how many people will take it. So
Didn't
insurances
their
will
stocks
reimburse.
just take a hit because they were only projecting like a 24%?
Well, only less than 20% got the bivalent.
Yeah.
So it's difficult to predict, you know. We know that pharmacies won't do children under 3. And there are very few provider doctor's offices that will, jump through the hoops, unfortunately. So.
Because the government is paying the drugstores to do it. So,
Right,
if they
right.
stop paying for that, that may
Yeah.
change it.
And I don't know if you've been in a pharmacy, recently, but they are busy.
Yeah.
They
You
are
can't get any
busy.
vaccinations at CVS or Walgreens without an appointment, and appointments are running 3 to 4 weeks.
Mhm. That does not surprise me.
And when does it arrive at 325?
Our vaccine?
Yeah.
So we're working on ordering them now. We have not actually put in our order yet because our numbers for private insurance, we had to get quotes. We wanted to make sure that, we have everything in order and have the best deal.
Is it possible to
Competitive
post,
bidding, right?
is it possible to post online which insurance companies the county can accept? So that might facilitate people signing up.
So that is part of our registration program or our registration procedure,
Mhm.
is to include that information. Or, a big issue of ours is that we're unable to, take the New York State employees insurance. So a lot of people in this county work for New York State.
They do.
Yes, and so that is a struggle that we come across a lot. So those people would either have to pay out of pocket, or they'd have to go somewhere else.
Now, you're also gonna have RSV vaccines.
Ideally, yes,
Now, there's an age threshold there. They're only
Yes.
recommending those for 60 or over,
right, and then, children who's their first RSV season, so like.
or, right, the little ones, yeah.
Yeah,
And so is it recommendation now or allowed where if someone comes into your office, they can actually get all 3 vaccinations once you get the Pfizer?
so I know you can get 2 at the same time. I'm not sure about 3. I'm not sure if we'd recommend getting
If you're a
all
mask
3.
person.
That's like, that's
Okay.
a lot.
At the hip.
Yeah,
Yeah.
that, you probably not feel, probably feel pretty run down after those 3 vaccines.
All right, are there any questions for Victoria?
Oh, she doesn't want
Answered a lot of them.
All right, let's roll into your next item.
I
Okay.
don't know, you fixed
so-
it, but you answered them.
Yeah, well, all right. So my next item is I am deeply saddened to report that the Director of Children with Special Needs, is retiring in February. Her date is February 28th. And I was instructed to bring it to your attention so that we could get a timeline, approved or set in place to find her replacement as quickly as possible, to leave as little of a gap as possible. So that is a master's level position. I deal with the master's in education or social work or closely related field with 3 years administrative and supervisory experience. So what I have in my mind, I would like for our current director to advertise to her network. Because ideally we get somebody who's involved in this program, maybe from, another county or wherever else we might, find them. So we'd like to start advertising in like October, November, December-ish. And like blast it out there as we get towards the end of that. And then interview during the month of December and January. I would like to select a candidate and, offer the position by the end of January so that they have a solid month, at that level to, take care of their current employer, whoever that may be. And then Anna's retiring February 28th and get them started as soon as possible thereafter. And then our civil service exam is scheduled for March of 24, so that it would be, the new hire would be provisional, until the results of that exam are back.
I'm assuming you're working with our HR department.
Mhm.
Budgeting for the overlap? Okay. Thank you. Any questions?
Nope.
Anything else, Director?
That's about it. Thank you so much.
Thank you. Terrific. Thank you.
Thank you.
Next up, Director Daniel Moffitt, Human Services.
Good afternoon, everybody. I'm gonna split the difference between Supervisor Laconia and Supervisor Abrams. Trying to fight off a cold. Don't take it
Oh,
personal.
no, that's fine.
Supervisor Adam.
Adams.
I set the pace with butchering a name. I'm sorry.
What did I say? Abrams.
Abrams.
I'm sorry.
This was like, we have a new
I didn't even
supervisor.
react to it. I know what you're talking about.
See, I'm off already. It's showing. See? So anyway, good afternoon, everybody. Light lit today, 4 resolutions, 2 general resolutions, 2 personnel resolutions. First general resolution is just asking for your support, and I'm very pleased to make this announcement that the Department of Human Services is interested in contracting with the Columbia Green Community College. We're the place in our staffing and our workforce that we are able to offer them some of our staff to the tune of probably 9-10 hours a week to meet the needs of the student body there at the college. So this is something that President Drummer has been asking for several years now.
You're on a contract one.
Yeah.
Oh, I'm sorry.
That's okay.
I'm
Yeah.
reading that. Sorry.
Yeah, I was going in order of your agenda, but that's okay.
My apologies. So with regard to the college, I think everybody understands what I'm saying. This is a milestone that I've been hoping to revisit for a long time now. And I just ask for your support in the Department of Human Services contract with the college.
Any further discussion? All in favor?
Aye.
Opposed? Carried.
Thank you. So now on to the second general resolution. Again, asking for your support to contract with Maxim, which is a recruiting service, excuse me. And we're just interested in broadening the number of recruiting, staffing, recruitment services that we deal with so that when we have a need, we're able to find somebody.
I'll move it. Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
This is the account clerk?
Yeah.
Yeah, okay.
Second.
Further discussion? All in favor? Opposed? Carried.
Next and final personnel resolution has to do with backfilling for a vacant budgeted position for behavioral health social worker. So we write these in the form of whether we find a behavioral health social worker candidate or the senior behavioral health social worker candidate, which would bring with them the LCSW versus the LMSW. So whichever type of candidate, we ask for your support.
I'll move
it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Yeah, I have a question for you regarding the contracts with Maxim. Do you, is it like a 10-week contract? When you make the request, it's like a 10-week contract, a 13-week contract for that person?
No, much longer than that, Supervisor. This would be, depending on the candidate that they find us, what we're looking for, whether it's a psychiatrist, a nurse practitioner, or in this case, they even are telling us that they can provide social workers. Social workers is a little more complicated because we have to engage in conversations with the PSCU. We haven't gone down that path yet to contract for social workers. We are currently, as you may recall, contracting for psychiatric nurse practitioners and for psychiatrists within our department. So that's a little easier, but those contracts vary in length from 1 year to 2 years
Okay.
for those.
You call me all the time.
Any questions for Director Almasi? Dan, in your report, you mentioned you meeting with the RUPCO, with the Wellness Center. I just want 2 minutes to comment on that.
Sure. So the latest update, I think you had a chance to look at my director's report with regard to RUPCO and also Galvin and the Wellness Hub. So we have engaged in conversations with RUPCO, which is an entity out of Ulster County, Rural Ulster Preservation Company, I believe is what the acronym stands for. And then I assume most of you are familiar with the Galvan Foundation. These are entities that have done property development, acted as landlords in some cases. In some instances, they've built the building and then handed it off. So particularly with RUPCO in Ulster County and even into Orange County and Dutchess, they've been extremely successful in cultivating behavioral health type housing, whether it's housing for the homeless or subsidized housing, step down housing for folks with mental health issues and such. So we're in conversations with them. We're not at the point where there's any sort of an agreement, a formal agreement that they are going to assist us, but just conversations are occurring as to what they might be able to do, what their capabilities would be, what they can bring to the table in terms of securing funding, whether it's capital funding to build the structure, and so on and so forth. While all of that is going on, and we also intend to request a meeting with the governor's office in the very near future. We're in the process of collecting data from multiple entities within Columbia County, whether it's social services, my department, the jail, the sheriff's department, Hudson Police Department, to help bolster our conversation / argument to the governor's office of the value that this would bring to our county if we were to have these three elements, which are the safe haven homeless shelter model, some additional housing, and then a welcome center, which would be a clearinghouse, a one-stop shop where individuals could come to learn about resources, services, and also, again, if the vision is successful, we would be relocating potentially the Department of Human Services to be on site so that the proximity was right there, and other providers might take up residence in that space as well. Again, for the proximity factor.
There's a great article on Saturday, the New Yorker Radio Hour, and with Jennifer Egan, who's just written another long article on housing for mentally ill and homeless, and how the return on investment. So might want to take a peek at that.
Thank you. If there's anything else about the report that I can speak to, one of the things at the very top I want to bring your attention to is that in accordance with the governor's budget and her request to bring inpatient psychiatric beds online, Capital District Psychiatric Center will be increasing their total number of beds by 10. This isn't going to be happening anytime soon. It's slated for 2025. CDPC is going through some renovations at the moment. The 10-bed increase, it is what it is. It's an increase of 10 beds. It's not going to make a monumental dent in the need, but it's going to be 10 more beds that we as a region have to draw from. What it'll do, actually, according to the director there, Deborah Murray, is that it will relieve some of the burden because they've had to house psychiatric patients in other areas, in other units. So they'll be able to bring them back to the more appropriate unit for that individual with the increase of the 10 beds. So more is needed for sure, but this is a nice increase nevertheless.
We'll take everyone making that.
And then I know we're pressed for time most likely. So the last thing I want to mention, and I'll stop, is that I'm extremely pleased in terms of the Department of Human Services to let all of you know that our walk-in clinic, the open access model, went live last week. We're offering that 2 days a week. There's a total of 4 slots each day for individuals to come in from the general public and present themselves for services at the Columbia County Mental Health Center. We have not offered this to our community in over 3 years. I know I've talked in here multiple times about, hey, we're close, we're optimistic, we're on the verge of launching it. Well, no more. We have launched it, and I'm very proud of that. I want to say thank you to all of you because it's a direct result of your support in terms of my department and staffing it and supporting us with, the bonuses that we use money from the state for, and all of the things that you supported in terms of the resolutions that I brought forward. So thank you for that. And I'm just proud to be able to serve the community in the way that I felt all along was necessary in the midst of a pandemic.
Does that mean that the wait list is being moved through too?
Yes, the wait list that Supervisor Cousin referred to had to do with providers, whether it was primary care, the courts, social services, etc. We were maintaining a wait list. The wait list that was comprised of individuals from the community that had already been dissolved, but there was a secondary wait list from community providers that's been resolved, and now our doors are ready to be open in the form of this walk-in clinic for the community at large. Granted, it's only 2 days a week, and as we continue to hire people, clinical staff, we will increase that to 3 days and 4 days when we initially rolled this out, it was 4 days a week, Monday through Thursday.
But your hiring looks a lot better than it did 6 months ago.
I'm sorry?
Your hiring looks a lot better than it did 6 months ago.
It does, despite the resignations that we got in terms of the account clerk and the
Yeah.
one clinical position. We will be, we have a person that has successfully gone through the vetting, and we're nailing down a start date for her to come to the clinic in a behavioral health social worker position. And then we have a senior behavioral health social worker starting at the end of October. And we have 2 interviews in the queue for next week.
Fantastic.
So things are starting to look more optimistic. Thank you, everybody.
Thank you. Thank you. Bravo, Director. Thank you. Okay, next up, DSS, Mr. Gibson, and youth. Dan Almasa. Not Dan Almasa, Dan Granite.
Dan, did you want to go first? Why don't you come on up?
I just had a few things to throw down. The one is the Teen Driver Safety Program. Someone had reached out to me and told me about a program down in Putnam County. So I reached out to them, and they have been kindly enough to allow us to participate. So I reached out to our county clerk, our county sheriff, and our Stop DWI program coordinator. And so this is what the pamphlets will look like. We'll get Spanish and English, and it's going to be sort of like a contract. So when a kid gets their permit, it will be like a kid and a parent signing a contract in terms of working together collaboratively, making sure it's a safe path to drive. And I think the research is clear that if you sign a contract, you're more apt to do what you say you're going to do. So I think it's not a binding contract per se, but I think it's a formal way of saying we're serious about driving safe. And, you know, the issue that was out, I think, the northern part of our county last month or so with a bunch of kids, even kids inside the trunk. So I think it was a time. I don't know how they got that many people in the car, but yeah. So scary. We are waiting to hear back. They're making the pamphlets. It's no cost to us. It's through the New York State Drivers Council. So so it'll be Orange County, Putnam County, Dutchess County, and they're allowing Columbia County, even though they're the Mid-Hudson, we're the capital district, they're allowing us to join them. So I thought that was kind of them.
Do you want to send me those and I'll send them out to them?
Oh, perfect.
Yeah.
Perfect.
I know there's a lot of adults out there that probably should subscribe to that. I was behind a bus and someone passed me. I was waiting for the bus and someone passed me on a double yellow. Coming up the hill. Crazy. All right. I digress. Sorry.
The other thing was to think differently. I had asked Kelly to send you out a note that we received in terms of the feedback at the Chatham
Yeah,
Fair.
very nice.
We received a lot of good feedback. Even the chairman, you were in there a couple of times when you saw people participate and take advantage of it. So I know you know firsthand that it was a success. We have October, November, December event come up at Cornell over the next 3 months that will have different trainings to address the issue. I spoke to Director Galena. She seems to think we're going to move more towards parents at first because we're not getting we're not getting much in terms of parents as of yet. So I think we're going to go with the adults first and maybe move the children to the spring. Okay. And then, so this is.
But when it comes to the community, if you have that, you know, the advertising pamphlets, we'll definitely receive them at our towns to share.
Yeah. Good. And then, so this is our prorated year. So we're ending on September 30th. So we're going to get all of the programs that were done in the summer. All the invoices are coming in. We're also addressing the transportation. And I know I apologize to some of the towns, but it's been a little bit more involved than just sending the invoice. So our bookkeepers need MOUs, they need something on your letterhead. So the commissioner has it in the process. It's just a little bit more involved. So I apologize for that to the towns, but it's working its way through the system. And then we are then allotted just again back to the normal amount of money for this coming year. because it's going to be a full year. So we're excited about that. We even received a couple other areas of funding where we can help out sports teams on top of sports, on top of youth sports and education. And now we can also do that as well. So slowly we're coming along, and that's my update.
Thank you. Yeah, and that Face It to Fair was terrific.
And also the staff, circus will be at Matt's Town Park on Sunday, from 1:30 to 3, for the circus program. So we're excited about that as well.
It's not it. They didn't give me.
Should be part of our community day. We have one more, for the contract in any town would like to take advantage of it as well, or city.
All right, thank you, Dan. Commissioner Gibson.
And I'll just say, that's my office, as far as all the towns and the summer, transportation. We do need to do it like that. It's how we recruit the funds, but it was absolutely bolstered this year. Participation in the summer camps, which is what we wanted. So we continue to do that. So thank you, Dan, for facilitating that. I'll get to my requests for resolutions quickly. First one, authorization to fill one social welfare examiner position and any backfills created therefrom.
Second.
Further discussion? All in favor? Aye. Opposed? Carried.
Authorization to fill one community services aide position and any backfills
Move
created
it.
therefrom.
Second.
Discussion? All in favor?
Aye.
Opposed? Carried.
Authorization to fill one administrative assistant position and any backfills created therefrom.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Request to authorize, for authorization to enter into an agreement with Columbia County Recovery Kitchen for the provision of meals to the Columbia County homeless population who are housed in various locations throughout the county.
I'll move that.
So a second?
I'll second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And authorization to enter into an agreement with Unlimited Care Inc. for the provision of independent medical.
Do I have a second?
Second.
Further discussion? All in favor? Aye.
Aye.
Opposed?
Ready for
Carried. Supervisor Knox says, get me out.
On the agenda, I did ask for some time to talk about an MDT update, but I did not realize at that time that we would have a presentation to kick off the meeting, and I don't wish to hold the committee up and certainly not you, Chairman, any longer. It's not something that I would like to rush through.
Okay.
So I would be happy to reschedule that for next month and just move to talk about a couple of things that I can do briefly, with the caveat that I have shared with Director Almasi, some of the things that I've gone through, and let this committee know that we need to be updating you regularly with some individuals that really do struggle in the community and that we struggle to provide care for. It's very important. It kind of goes to what Director Almasi was talking about. Yes, we're very pleased that there are 10 more beds in CDPC. We sure hope that there's some cooperation with this rural county when we do need that type of service, and we hope that the state can provide us with some more resource. But Director Almasi and I will be meeting next week with our deputies. We're going to talk through some things, so it might even be better if I brought this up in fuller length and context next month.
So you're marked some time next month. Okay,
Absolutely.
terrific.
Okay, let me know if there's another presentation from outside before, because I certainly don't want to take up too much time. I will have you note from the statistics, the homeless number has dropped.
Deep drop.
And we have been able to house permanently in a way that we hadn't in a while, so I'm pleased about that. They're much more, the numbers are at least more manageable. They're not good. They're more manageable.
But as we're going into winter.
Right,
they're
as
actually
we approach
fantastic.
winter, I'm very pleased about that. I will keep you updated on that. I do not have an official, anything official on the creation of a mission that would help us house folks under Code Blue. So I don't want to get too specific on that. But it is my hope that I'm closer than we've ever been, and that this time next month, we'll be presenting something to the committee that will be a pretty big game change. But again, with this being a public meeting, I just put that out there. I think in partnership with other nonprofits around the greater Hudson area and with the space over on Green Street and the Dutch Reformed Church, we may have figured out a way to serve people 7 days a week, both from a nutritional standpoint and also from an overnight Code Blue if they are not clients of DSS. So with that, I will conclude and go further into depth on that during this next month, probably with individual supervisors as I move forward. And I will get ready to present more fully on MDT.
Okay. Now, can you give us any specifics on why housing is opened up and why you were able to put these, these residents permanent?
Well, I can tell you, some spaces became available that hadn't been. I don't know why that is. I'm just happy that it is. And people who have been waiting a long time have been able to get permanent housing. And it's just moved everything around. It shuffles the deck, and we're able to now see a smaller emergency housing population. I do anticipate that as we go forward the next few years, you should see a lot more of that. I don't know in the immediate future that we will, but with the projects already slated over on 7th Street, what I'm hearing out of the city of Hudson, and a couple of spots there, and what I'm hearing from Hudson Housing. So we're optimistic that you would continue to see this, and we're just pleased to be able to report it now.
Okay.
Is there a need, Bob, for next month to start earlier, or do you think?
No, I think if we had that amount of time that we used, which was certainly appropriate and needed, I just didn't know it going in when I had asked. So, no, that's fine. Just let me know if some outside group needs time. It's still going to be okay.
Okay.
All right, thanks so much.
Any questions from the committee for Commissioner Gibson? All right.
Thank you.
That being all of our business, I'll ask for any public comment. There being no public comment, anything further from the supervisors? A motion to adjourn, do I have one?
I'll make that motion.
So a second, all in favor?
Aye.
Opposed? Thank you, everyone.
Public Safety Committee meeting to order, please. First item on the agenda is the judge's resolution. Everybody's had an opportunity to see this. I know that we had discussed this previously in public safety. It was brought up at the board meeting, the full board, a week ago, and now it's back in public safety. So before we vote on it, I'd like any questions from the committee or any thoughts? No reason to have another presentation from the judges, so.
I guess I think I know where people's vote stands. I'm unlikely to support this, but there is a couple places in the text that stand out to me as a little odd, but maybe those who want to support it, you don't mind. I thought the first resolved is maybe it's pretty vague. Just don't change don't make changes for the last 200 years. But I assume that there's lots of changes that have happened in the last 200 years about who can be a judge that we like. Both opening up who can be a judge over the last 200 years, and also the requirements for being a judge have changed over the past 200 years. And I assume that some of those changes the board would support. And then the paragraph before that, this legislative body views that the intention of the bill is not to actually improve the courts. We haven't heard a presentation from the people who wrote the bill. We haven't done any research about what their actual intention is. So to me, it feels like an overreach to describe the intention of people that we don't know.
Okay. Any other comments?
I
Oh, go.
No, ladies before gentlemen, please. I'm from old school.
Yeah,
Your
so,
school.
yeah, my school.
That's right.
Roland Jansen, not Aqua.
I know, we were close.
Okay, so, I mean, people know where I stand on this. And of course, my view was influenced by the fact that, I did practice law. I had a law degree. I practiced law in these justice courts. And I know what goes on there. And I think that it would be unfortunate to understand that this law was somehow attacking or denigrating the service of these people that have come to see us and to talk to us, because that's not what it's about. It's simply recognizing the gravity of what goes on in these little courts, and saying that there's standards. And it's not, anybody who's sitting now is not going to be forced to leave. Anyone who's sitting now can continue to serve. And it only applies to the busiest 100 courts. So that's my view. I mean, I know that our chairman was a judge, and
Yeah.
I'm sure a very fine judge, and then I've known many good judges that didn't have law degrees, but I think if you're setting a standard, this is a wise. That's okay.
If I could. Sure. I really think that the people that live in the jurisdiction should choose whether they want a lawyer judge or a lay judge. And I think it shouldn't be up to us necessarily. It should be up to the people who are who may elect these people.
Well, I feel that no matter what we decide here today, that people above us are gonna make decisions that we don't really have much say in. But I gotta say this, I think supporting the judges that we've had them all our lives. We've lived here with them, and that's the way it's been. And I know changes are coming, but we won't be making the changes, they will. So if they decide to make the changes, that's up to them. But right now, I'd rather support the people that have been working with us for all these years, because they've done such a tremendous job.
I agree. You know, I got a feeling that this is just a stepping stone. It's the first 100, but you know, what's next? I mean, they're not going to stop there once they roll this out. So it's going to come roll down to every town, and it is going to be a financial burden to the towns as well, because if you start paying lawyers, you're going to find out that salaries are going to be, they're going to demand more money. So I think it's going to have a cost to the towns more money to do this as well. So I've supported this all along. I continue to support it.
I'm in agreement with Kippy and Ray. It's right now they're reaching up, top 100, and where does it stop? And I'm barely making enough fines to pay my judges now. And if I have to up their salaries, it's just not going to be feasible.
Okay, I think there was somebody online.
Supervisor. No, she didn't get on.
Okay. She asked, but we
sent her the link.
accommodated her,
Yeah, and I texted her.
she didn't come on.
I'll move the resolution.
Second, all in favor? Aye. Opposed?
Opposed.
So carried. Resolution, whatever number this is, 2023.
It's gonna be assigned when we get to the.
Okay. Okay, well, thank you, everybody.
And this does not have to go through finance since it's already going.
Correct.
You mind, are you sure?
Yes. Okay.
We thank you very much for your time.
Oh, Andrew's on there.
You're welcome.
Thank you.
Gary? Did you want to say anything? Did you want to say anything?
Unless you want to give her an opportunity to ask. We already passed. Thank you. If you want to have her speak since she came on, hang on 1 second if you would, please.
Okay.
Go ahead.
Tistria? Yeah.
We asked if you were on and you weren't, and the resolution passed, but now that you're on, if you still want to ask a question before anybody leaves.
Oh, you put the brand new agenda item at the front of the agenda? Sorry. I was dropping kids off. I guess it's a moot point. I just, at this point it's passed. I feel like we should not be in the practice of admonishing our state legislators. I feel like if people want to get involved in state legislation, they should be state legislators. I understand if it affects our county and our towns, that as local leaders, we want to let our state leaders know, the effects that it's going to have on our towns. I'm still trying to get a definitive answer. I've reached out to both Senator Hinchy's office and Assemblymember Barrett's office, because according to the county attorney, it's a little bit vague in the language what the top 100 towns are. At the very least, it affects one town in Columbia County if we go by the highest revenues, according to what Kelly sent out, and that's the town of Taconic. If it goes by criminal dockets, I'm almost certain that Columbia County does not come in the top 100 towns for the amount of criminal dockets, which typically have less revenue attached to it. It's typically those traffic tickets that bring in the revenue. So I think as a process, we should steer clear of getting involved in things that aren't an effect to our direct constituents. And I feel very strongly about that. Thank you.
You're welcome. Thank you. Public Defender?
Evening.
How are you?
And, two resolution requests this evening. First, I'm asking, for Columbia County, requesting authorization for Columbia County to renew the contract with Ernest Ryan Investigation Services LLC. It would be for a 3-year contract, hourly rate of $50 an hour, and not to exceed $200,000. And this is paid fully by state grants and the Burrell Herring settlement. This is the gentleman that I've had in my services since I started.
I'll move it.
4 years.
Second?
Second.
All in favor? Aye. Opposed? So carried.
And then secondly, requesting authorization for Columbia County to renew contract of the 4 council at first arraignment attorneys who will be independent contractors, yearly rate of $40,000. And they handle all the off-hour arraignments, and the contract will run through the first of 2024 till the end of 2024, 100% paid by state grant.
Move it. Second. All in favor? Opposed? So carried.
Thank you. And I just found on the agenda, but I just thought just a moment of silence for Nick's Chubb last night. I apologize for that awful knee injury that he suffered. I appreciate that. I knew. I felt bad. I thought of you when so hopefully, quick recovery.
Thank you. Sheriff.
Evening, everyone.
Evening, Sheriff.
Good evening.
See most of you again.
3 times today.
Time to charm. A few resolutions on the table tonight. First is to authorize and fill vacant budget full-time deputy sheriff's position based
Move
on.
it. Second.
All in favor?
Aye.
Opposed?
Second,
Carried.
second authorize and fill budget full-time corrections officer
Move
position.
it. Second.
Second.
All in favor?
Aye.
Opposed? So carried.
Authorization to upgrade corrections officer position to corrections information technology officer.
Move it.
Second.
All in favor?
Aye.
Opposed? So carried.
Next is authorization to fill current budgeted senior auto mechanic 1 position and create and fill an additional senior auto mechanic position to abolish and to abolish the second senior auto mechanic position. So it'll be we abolished 1 position. There's 3 mechanics in our office. Now there's 2. We're just moving them up a step.
I'll move it. It's gonna save us money.
Yeah, I'll second.
All in favor?
Aye.
Opposed? So carried.
Authorization for the board of supervisors to authorize a proclamation and recognition of Sheriff's Week in Columbia County. That's the 17th throughout this week.
Do we need a motion to do a proclamation? We'll do the proclamation.
Thank you very much.
Except we probably should have done it at last month's meeting, right? Because it's this week.
Well,
Well, in recognition
Better
of
late.
the past together.
Better late than never.
Well, happy Sheriff's Week.
Happy Sheriff's Week.
Yeah.
It's already begun.
We can take a moment.
Thank you. It's been quite the week.
Right up there with National Cheeseburger Day yesterday.
It's funny, it falls on my anniversary day of my hire today.
Ah, happy anniversary.
Thank you. The next resolution is authorize the sheriff's office, vehicle to be declared surplus and set to county auction.
Move it.
Second.
And for.
All in favor?
Aye.
Opposed? So carried.
And lastly, authorization for 2 sheriff's office vehicles to be declared surplus and sent to the county.
Move it.
Second.
All in favor? Aye. Opposed? So carried.
We have a County inmate report, should be incarcerated individual report.
Franklin County, revenue $9,360, Green County $7,360, Ulster County $2,635. Total for August $19,345. Year to date, $256,685. Change from previous year, 71,835. Currently, we have 46 incarcerated individuals, 4 from Green County, 2 from Franklin, 1 from Ulster, no federal incarcerated.
What's going on with Franklin County? It seems like they're higher than Green.
Yeah, I'm not gonna ask any questions as long as they keep sending them. We'll keep taking it.
Keep paying, right?
Yeah. So,
Any other questions for the sheriff? Thank you.
thank you, appreciate it. Thank you very much.
EMS?
Now you go,
I did see on the news this morning where Columbia County Sheriff's Department is having muffins and donuts.
Yeah. We all saw
I might get an invite.
We're actually, that's actually doing a barbecue for the folks on Thursday. If anyone wants to stop by, we'll be up there. Thank you all.
Thank you.
All right, September was last week was our first meeting with the EMS agencies, regarding our consultants report. So, like I said in the beginning, this is actually a strategic report, in helping us determine how we're gonna remain solvent for like the next several years. So we talked about a few topics, that I presented. Some topics that we talked about were short-term things that we could do right in the beginning. Number one was automatic vehicle locators for 911. Lots of times an ambulance is much closer to a call, but they don't know it. It's very important that 911, who's the quarterback of the system, knows where these ambulances are. One of the things identified in the report was the demand versus the resources, the staffing that's available. We are at times not meeting that demand, whereby sometimes we have way too much staff, and vice versa. Other times the demand is compared to our staffing levels. One of the things that was identified in the report was the nighttime staffing. So that's something that we're going to try to address as well. We do have to present to Columbia Memorial benchmarks for interfacility transports. In other words, it would depend upon the acuity of the call, whether it's a critical call or a less critical call, and establish timelines to respond to the hospital for those transports. The key is that we keep those transports in Columbia County within our system, because what was identified is that it's close to $700,000 worth of revenue that is generated from those transports. And if we did not have those and the hospital decide to contract with an outside commercial outfit, that would become an additional taxpayer burden. So those are immediate things that we look to address. Obviously, all the agencies have kind of agreed. Nobody's going to lay down their sword and just say, okay, we're out of business and we're just going to fold into one agency. But I think we have to walk before we run. We do have a system in place right now, Columbia County EMS system. All the agencies are members of that system. And what I presented to them was the fact that I think what we need to do is to be able to enhance this system and strengthen it, both from an accountability factor and an operational factor. These are the things that we're going to talk about as we move forward, and hopefully very soon. How do we want to structure this? I think we need a little bit more support maybe on this advisory board that we have from the board of supervisors. And we also, because of the transparency that have been brought up both in the report from me and as well as you as a board of supervisors, by about $3.5 million worth of taxpayer money pumped into the system, that there needs to be accountability from these agencies. There's no question about that. We also need to make sure that these agencies remain financially stable. It was identified in the report that basically they're operating on shoestrings, money in and money out. It's no way to sustain a system. I identified the fact that we need to come up with an equal equal payment to these agencies based on some sort of standard. We've thrown around number of parcels, assessed value, but actually what I'm working on right now, and I hope to have to report to you next month's meeting, would be, I think, the fairest way is by population. You will see that the population actually correlates with the number of calls in a particular town and within the city of Hudson as well. Fortunately and unfortunately, when we do this, towns in the northern part of the county will think it's great. Towns in the city of Hudson in the middle of part of the county won't think it's so great, but it's something I think we have to do. Every town in the city are receiving equalized service right now, but yet we're having a large disparity in what each town is paying, from 7 or 9 cents per thousand to 60-some cents per thousand. So that was identified in the report, and I think we have maybe an answer how to do that and to move forward to it. There are other things that we need to do. If these agencies, what I presented is that I think that if we keep this current structure of CCMS and we enhance the board, the agency should then be coming to the structure with the budget requests, so that there would be more accountability and we can review that. I think that it will equalize itself out and help keep some of the operational costs down. And together with that, this particular CCMS agency, when we have contracts with the individual agencies, we can actually beef up some of the contracts to incorporate some performance standards that are not in there now and work towards some of the benchmarks that have been identified. So that was what was presented to them. I presented that this week to them. Everybody has agreed that we need to work towards these. Obviously, much easier said than done, but I think there are critical things that we need to do right in the beginning. And I think for the year 25 especially, obviously it's too late for 24, but we need to come up with a standard of accountability and fairness and to the taxpayer.
Did all the agencies attend?
All but one was there at this particular meeting because they had a conflict.
And did they recognize the disparities that you're talking about?
Yes. Yeah. But, it's going to take some time. That's just, we're not going to throw the switch and everybody lays down the sword, but you have to walk before you run. You have to gain their trust, their accountability, and make them feel that they are part of the decision making. That's the way I've always operated, and I think that's important to kind of hold their hand. Everybody wants an improved system. They want enhanced standards for the patients, and we know how to get that and how to move towards that. But we give and take in trying to move towards that direction. But I think the accountability is critical at this point in time.
Supervisor Holding has a question.
Yeah, I see that. So how do you get everybody to the table and start doing this?
Working together, we're going to start work groups amongst the advisory boards and working towards some of these issues.
And they're all open to that?
Yes.
Good. Okay.
Yep.
Is there any other questions from the supervisors?
Jerry, do you feel that the services are understaffed right at the moment, or they seem to have enough people?
Actually, the staffing levels are, I hate to say this, but sufficient at the moment. They seem to be sufficient. However, quite frankly, at times we were overstaffed and other times we were understaffed. So that's going to be an operational issue that we're going to have to try to work towards. But it fluctuates greatly due to hold up times at the hospitals, the demand, so on and so forth. So, the only way to do that is to work towards this, is that this system has to operate a little more fluid than it is right now. And, you don't understand that, but what I'm saying is that we need to act together as one system. When you have 10 or 11 agencies in service or ambulances in service, okay, you can't be saying, well, we're not going to go here or there. We actually have to work together a little bit more.
Other questions? There's a question from Tistria.
Yep.
Hi. Thank you so much, PJ, for all of this hard work. And I definitely agree with the tracking system, because I know with an outlier town like New Lebanon, that's been an issue a couple times where, ambulances have been out on call, and because there's not that system in place to know where everyone should be standing, it makes it for longer call times. And then my other note is on the all municipalities charge the same rate per thousand of assessed value. I completely agree with that. Do you have what each municipality currently pays? And if so, could you share that with the committee as far as, New Lebanon pays X per thousand, Austerlitz pays Y per thousand?
Sure, I'd be glad to.
Okay, awesome. Thank you so much.
Yep. But you're saying that you think there's a better way to charge?
I think there's a much-
I don't agree with the assessed value, and I don't want to get into it right now, but I don't agree with it at all.
I think that next month when I come and present some of this, I think you'll see that it's much fairer.
Yeah, I
And
agree.
it correlates to obviously.
Yeah, the population is, assessed value, I don't see what relevance that
And
has.
assessed value fluctuates.
$125 million home.
And if you have a community that is, has more, how is that relevant? It's really about bodies and people that you're going to.
That's correct.
And the need, where the need's gonna be, where the population.
Anyway, but that's a bigger discussion.
Yep. Okay.
Thank you.
Yep.
Thank you, Jeff.
District attorney's not here, so, he did ask if he had something, a conflict come up. Authorization for the district attorney to accept aid to move it.
Second.
All in favor?
Aye.
Opposed? So carried.
Let's look at that long.
What's that? Quicker, you won't have to say anything.
Let's put grant first.
That's right.
The grant, all this.
Name
Grant. Accept the grant.
I trick you and throw in some other things.
Probably, that's it.
Fire?
I just got an activity report, and I'll answer any questions if anybody's got any.
All right.
Any questions? Thank you.
That was it. Thank you.
Emergency management.
All right, emergency report, no resolution requests. And we also wanted to let the committee know that working with the fire coordinator, we completed an audit of our expired hand sanitizer that we were given by New York State. And because at some point there's going to be an expense to the county to get rid of it. In the past, we haven't brought it to the county before this, or just, we don't have a price yet, but informed the county on this previously, because in emails and verbally, we've been told by New York State that they were working on a process that would include the counties. However, that hasn't happened. We've been told it's not gonna happen. In fact, the state has hundreds of thousands of gallons of expired sanitizer, hand sanitizer on a runway in central New York. So we have about 1,300 gallons from various county departments. And that's the fire coordinator's working on getting a price for getting rid of that. Oversight is by the FDA when you're using it to sanitize your hands. Once it expires, and this is in writing, that the oversight is by EPA.
I think it would never expire.
Yeah.
When you buy
It does,
alcohol,
yeah.
vodka never
Does it have a
expires.
date on? Like, how do you know?
Yeah, unfortunately.
No, it hasn't, but
Unfortunately, as you may remember, we went through the process of giving it out during COVID.
Yeah.
And we had to order for the next week. We had 2 days a week that we would hand it out at the public safety facility. And
Yeah.
we had a line of vehicles that would come in and get it, and the county departments and everybody else. Well, that, without any, not very much prior notice, they stopped it. So we weren't able to, wean down and use what we had built up, because we had to have enough. We had to order each week. We had to have enough for the next week. So anyway, and some departments, built up their stockpile and whatever. So 1,300 gallons, the fire coordinator's working on a price with a company, and we'll let you know in the future.
I was just gonna say, I might be able to burn it, right? I mean, I'm thinking how
It's a hazardous material because it's flammable.
Right, I know it's.
Because it's ice and profile alcohol, it has to be determined hazardous waste.
Right.
If they made it out of something else.
Thank you. Any questions?
I do.
Burns good in here.
Don't run away.
Yes, sir.
Question. So the report on you saw the news where the city's been wiped out by 2 dams. And remember we took one up and met that dam. I think the one above Philmont. Remember we met there.
Oh, yeah.
Did we get the final eye on that dam that?
Yes.
Okay.
Yeah, you should be getting that. I got an email that, the dam's all set. There should be an action plan.
Okay. I mean, I
Works
thought it was
action.
coming. I didn't know if we get the end result.
Yeah, you'll get it. Yeah.
Okay.
The town supervisor gets it, or the mayor, or whoever
Okay.
gets it. Typically violations are for they don't have updated plans filed with the state or whatever.
Right.
So, yeah, as best I know, that worked out a lot better than I thought it would there.
Better to look at, especially when you cut the trees off.
Yeah, but that was part of it. They allowed the trees to grow, the
Roots
roots get in there.
opened up.
Yeah.
Yeah.
So, for those that don't know, New York State DEC has a dam unit that comes down and does inspections for dams that are involved in holding back a certain amount of water. So.
You got 2. On that one creek.
Yeah, we had 2, what's called Class C dams, and that's, the Summit Street Dam and the, Churchtown Dam, which is a dam for the water supply for the city of Hudson. But those, they're the most, if they had a catastrophic failure, they would allow the most water to flow out of there. And, other than that, we have, medium level dams in the county, and then smaller ones. So far, most of the dams that we have are pretty well
shape. Yeah.
Yeah, maintained.
Not like the ones over.
The state stays on top of it.
Not like the ones in the news in that other country when they go over the hills.
Oh,
Michael, did you have a question?
Yeah, on the hand sanitizer, I would imagine that some of the towns in the city of Hudson also have some of that, like those giant gallons left over. And maybe even, I know that I helped a lot of businesses get those, but I wonder if some of them still have some left over. So I wonder if it's worth putting out a statement, something to the effect of, hey, your hand sanitizer that you got 2 years ago is probably expired. And
Well, it's
here's
right
what-
on. I mean,
Is
there's an expiration date right on it, and it's easy to find the information that tells you how you have to dispose of it. Like you could have a cement company that can use it to burn off there's certain things that you can do, but it's clear it has to be treated as.
So if the county's looking into that, can the towns bring theirs there? Or?
Well, I mean, that would be something that would have to be worked out with cost. We could certainly let them know about the price.
I mean, even if the towns
I don't
pay,
know.
just so they have a place to get rid of it. Yeah, I have a bunch of it.
I imagine a lot of places have 5 or 10, right? I mean,
Well, I have cases.
Yeah.
I don't think that we could put it all together because I don't know how the cost would be. But we could certainly make sure that the town knows about how we're doing it, what company, we'll go through the process depending on the
But if you're getting a price per
cost.
gallon or per case, maybe you could say any town, this is what it costs. I mean, I'd be happy to pay. We're not looking for the county to pay, but just a place to drop it off and get rid of it. All right, thank you.
Well, I would also think.
Any other questions from the committee? Any questions from the committee?
I would
Any
also think,
questions?
Rob, if the towns were gonna pay themselves, but like, they're not gonna come to New Lebanon to get 4 gallons. So I
No,
do
they
think
have
the
to drop
county
it
could
off.
at least be like a collection location for all of it, whereas, the town got charged for 10 gallons, the county got charged for their 1,300, but there could be some coordination there, at least for the,
I'm bringing,
pickup of it.
bringing my case.
Yeah, I think that we could work that out. Any questions from the public? I do know that Nadine is here from one of our local business people. She was here last month, and Matt and I had met with her afterwards, and then she was, I don't know, what do you have first?
So, yes, I just wanted to give you an update on the new background check that the state took over. So it's.
Just why don't you reintroduce yourself?
Okay, Nadine Gazzola, Zero Tolerance Gun Shop. Tuesday, the 12th, we got a 21-page user guide. 4 of the pages pertain to payment of how we were going to pay for it. But there was not much information other than that. We don't know what to do with different things. There's still a lot of unanswered questions. We did strike on the 13th, so we did not open. We did not process anything. We opened on the 14th. All 7 transactions that I did were delayed. Friday, we opened, I think about 7 or 8 more transactions. 4 of them were delayed. Some have proceeded. One of them is actually retired law enforcement. His status went to under review, which does not explain what that means in the user guide. And it's still under review. So even retired law enforcement are getting, delayed, as we call them. We had another gentleman, works corrections. He was delayed. He uses ammo and such for training. He called up the helpline and was told, well, that's because we have to manually put it into the federal system. This throws up a red flag because that's illegal on a federal level, once again. You cannot use the federal system to do a background check for ammunition. It's spelled out in the law. If I did that as a business, I would get a $10,000 fine each time I did that. We have had different motions in. We do currently still have a motion in with the Supreme Court with Justice Thomas, even though the news is reporting differently. We have been waiting for an answer from that. He has been given updates, even as far as the Friday issue, by them using the NICS to do the background check illegally. It's not an easy system to use. It takes what used to be a couple minutes is now a 15-minute process of somebody standing in front of me, announcing in front of the public, I need your social security number, I need your email address, all this information. And it's a concern if there's a room full of people behind them as we're giving that information out. So there's a lot of concerns with it. We're managing to get through. People are still coming up, well, if I have my pistol permit, why do I have to do this? I've already been approved. Well, yes, but each time now you have to be approved again. So it's not an easy thing. We know that the fees, the taxes, and we call them a tax, it's a tax on something that used to be free. It's not right. So thought I'd give you an update.
When you say that they're delayed, are they going through though?
Some are, some aren't. I mean, like the one, he's buying a box of ammo. What we have to put in is we have to put in the make, the caliber, how many rounds they're getting, distinguishing information. This is for the ammunition, which they're once again creating a database of all this information, which is also against federal law. So there's multiple laws on each level that are being broken. And I know last time I was here, there's a lot of different things that happen with this system that are against federal law. And unless you're in it, you don't know it. And it's hard to explain a lot of times. So I live it every day. So there's a lot of things that happen. Yeah.
So question,
Yes.
do I come see you now or should I wait a week or two and see? if
Don't
the
wait
system-
for a Saturday because you'll get delayed. The other concern is the same gentleman that called up, he actually was told that people are doing these checks remotely. So that means that somebody's sitting in their house getting the information of a social security number, email address, date of birth, all this information. They're sitting at home and inputting this information. That's a lot of security issues that we have heard. I don't have confirmation, but we've heard on the first day the hackers are out there. Like stuff is not going through as smooth as it should. So now if somebody's sitting at their house having access to that information, that's another concern.
Are these state police sitting at their house doing it, or?
I don't know.
Are they working?
I don't know where it's going. Yeah. I know when the gentleman, he had called 2 different times. He got a woman the first time and a man the second time. So it was a call center. You could kind of hear it. But I don't know.
But the state police have been.
They are the ones, they are in charge of overseeing it. It is an independent company that has the program, shall we say. But it is supposed to be the state police that's using it. But yeah, there's many, many laws that are being broken. And unfortunately, this now ties back into, am I the one that's responsible? Because I know in the firearm aspect, if I get a proceed from the state and something's not right, but I give you the gun, I'm the one that's responsible and going to jail, not the state. Because I'm the one that turned that over. We as a gun shop and FFLs, we're the last line of defense in any of this. So it's our responsibility to say, yes, you can have a gun, no, you can't. Even if I get a proceed, I can still deny somebody a transaction. I can say, no, I'm not giving you that gun. No, I'm not giving you that ammo. I have that ability to do that. Yeah. And
Have you reached out to the state police?
because I'm a litigant in our lawsuit, I can't. Yeah, I do know, Sheriff's Department, it took them about 2.5 weeks to get logged into the system because they were trying right from the get-go, and they had many issues with the payment portion because you need a tax.gov business portal, which is another whole fiasco because it's not a simple login. You have to log into this one, go to a new screen to log into this one, to then go to another.
It's like Sandra.
It's insane. There's no yeah. When 2 weeks ago, we had a system, boom, you go in, you log in, you do it, and you're done. You know, there was already a system in place.
And this is just New York State, right?
This is just New York State. Yes.
They want the revenue.
They want the revenue.
That's what it's
They want the
all
revenue,
about.
yeah.
Revenue.
It's $2.50 per transaction for ammunition and $9 per firearm. And it was free through the federal system.
Per box or price?
It is per transaction. So yeah, so if you do ammo and a gun on one transaction, it would be $11.50. So
$5 maybe is $2.50.
it's still $2.50. Yeah, but I can't just say you got this 12 gauge. I have to say, okay, you got Hornady, which is a manufacturer, this many rounds. You got Federal, this many rounds. You got this, so many rounds. Like we have to spell it each out. So
I'm sorry, I have another meeting, but
that's okay. Yeah, thank you. Yeah.
Sounds good.
Yeah,
Thank you for
thank you.
coming and
Yes.
thank you for updating us.
Yep.
Any other questions from the public? Tistria, you had a question?
I just had a comment. We had a terrible accident here in New Lebanon, and I just wanted to thank the LVPA and all the neighboring fire companies and the EMS system, state police, emergency management. Unfortunately, it did result in 2 deaths, but everybody was very professional, prompt, and my heart goes out to everyone affected. So thank you for everyone that responded so quickly.
Thank you. Any other questions from the public? Motion to adjourn?
Motion.
Second?
Second.
All in favor? Aye. Thank you, everybody.